Welcome everyone, we're going to talk about plantar fasciitis. When understanding plantar fasciitis specifically, there's a couple things we usually have to ask when we're working with individuals. My name's Dylan England and I've worked with thousands of individuals, many of them having plantar fasciitis, and helping them work through their aches, pains, and limitations. One of the things that I want to talk about today is essentially the point of pain. So identifying whether or not it is in fact plantar fasciitis or something a little bit different, like a calcaneal bone spur or something along the lines of that. Often we'll talk about the point of pain. So where it is, plantar fascia itself along the bottom of the foot there. If there's pinpoint pain often as well, right at the base of the calcanea, so right at that heel, right in front there. If that is one of the points of pain, that's going to be an identifying marker for plantar fasciitis. Another thought is when you first get out of bed. So when you first go to stand up after sitting in a chair, first get out of bed, put that foot down, get that weight bearing, and you start to notice that pain, maybe pretty sharp. That's another indication. It may actually be plantar fasciitis. First, right at the base of the heel here, where you have the Achilles that runs up the heel. That's where it would identify more of another possible issue. Next, looking at the mobility of the foot. So a lot of times we don't move through an entire range of motion of what our joints naturally should have. And in turn, that can limit things. When our foot's limited with movement and then we try to go out and do something at an increased rate or increased level of movement or an increased amount of force, that can stress that fascia, or stress the tendons, stress the muscles. And in turn, you may not have the time to adapt or accommodate the necessary stability, necessary mobility to do the things you want to do. So talking about something like the windlass mechanism. So the windlass mechanism essentially is the mobility of the foot and the flexor hallucis longus, which is one of the muscles that attach to the foot or the bottom of the foot. We want to look at the big toe, essentially. If we pull up on that big toe without letting our entire foot dorsiflex, so go upwards, you'll see an arch lift there. If this is very tight, so if flexor hallucis longus is very limited, that can cause some stress when you're walking. If you're a runner, you'll have what's called a heel whip, where your foot is kicking in, and you'll often find that there's dirt just on the inside of your foot, especially if you're a trail runner or something like that, because your heel keeps kicking and running across, your foot's turning outward based on lack of dorsiflexion of that greater toe or of that big toe. So what we want to do about that, working on stretching that out. Now, something like rolling a ball at the bottom of the foot could work to reduce some tone of some muscle attachment points there. The tricky part is most of that's tendon that's going to be down there, if not connective tissue and fascia. So most people may not have wonderful results with that because of that factor. There's 3 other muscles we'll usually look at when it comes to plantar fasciitis and maybe the lack of mobility, if not lack of stability. So working on getting that big toe moving first, one of the exercises we want to focus on would be like a rock back, where you've got the big toe being stretched. Based on it being behind you, you're shifting forward, pushing weight down into that foot. I'm giving myself a decent amount of pressure. As you can probably see my heel shaking a little bit. That's one idea of something you can do to try to get it loosened up a little bit, as long as it's tolerable. And I'm stepping forward, rocking back. It doesn't have to be up on a step like this. This is just an example for visual and giving that initial step because it's going to play a role with another stretch I'm going to show you a little bit later. Another thought is working on a couple other muscles. So 4 muscles I want you to think about is flexor hallucis longus, we just talked about, tibialis anterior, tibialis posterior. So tibialis anterior is usually the muscle we think about in the front of the shin there. It actually does attach to the bottom of the foot and can play a role as it pulls the foot up. If it's lacking, that can be an affecting muscle. Tibialis posterior along the back of the leg, and then the fibularis muscles. So it's a group of muscles just on the outside of the right outside of the leg here, wrapped down and around and attached to the base of the foot, as well as posterior tibialis being on the inside of the leg, going down and attaching right below the foot. So those 2 muscles essentially help create a hammock of the arch that also contributes to possibly some issues or limitations for plantar fasciitis. So one of the exercises we can do to overall work on the mobility of those and probably get those muscles firing a little bit more than what they're currently doing would be something like a lunge forward, focusing on keeping that heel down. As we translate forward, we'll come back. We're gonna maybe veer inward a little bit, which might feel a little awkward. We're doing this for some ankle mobility, not necessarily teaching a strengthening lunging movement with that. Coming back, we can go outwards a little bit. Again, keep that heel down. And we're just slowly rocking back and forth. You can do 15 to 25 repetitions as long as that feels okay for your knee. I'm not trying to force all of my weight into that leg. I'm just trying to get some stretching, get some mobility in that ankle and play with that movement a little bit to get things loosened up. Another variation, I'm gonna kick this out of the way, is going to be a turning stop. So keeping that foot based on the ground. When I turn, my foot's going to do what's called pronation. My foot's gonna collapse inward, which is naturally a normal movement for walking and running. But if your foot isn't pronating very well, it's stuck in a supinated position because that arch is so strong, then that's going to limit the mechanics and movement and likely stress some of those muscles and tendons when you're trying to walk or run. So doing a transverse movement, we are essentially stepping, keeping that foot based. And you'll notice from here where my foot rotates inward, I'm gonna step across, it's gonna rotate outward, and that's actually gonna feed into more of an arch. I suppose you can't see from here, but rotate away from that foot on the out. You'll see my arch up and back. And I'm just playing with that movement, getting the foot and ankle loosened a little bit. But at the same time, what's pushing and pulling me is my foot and ankle. So are those four muscles I was just talking about all playing a role to get that movement, that stability? And we're working on dynamic mobility specifically, not just the static stretching that you'll usually think of when it comes to mobility for your foot and ankle. What I mean by that, so a static stretch would be stepping up on stairs and you're just dropping your feet off. And we're just hanging out here. So we can hang out here for a minute and then you realize, I've tried that. It doesn't work. We're gonna do something different. Dynamic mobility is more applicable. So when you're walking, when you're running, that's when you notice some of your issues. Let's train the muscles to lengthen. Let's train our nervous system to allow that lengthening to take place. So instead of just statically standing there, we're gonna work on dynamic mobility. So getting that drop, pause for a brief moment, switch, switch, switch. So you can do this on stairs or something that's raised. We're getting that drop of the heel as we're slowly alternating back and forth. I'm using the foam roller just for the sake of stability. If you have a handrail off of your steps, of course that's going to be ideal. Have something around so there's not the risk of falling back as you're going back and forth. So there are 4 examples. You've got the rock backs where you're trying to get that big toe stretch, loosening the foot up. You've got the lunge mobility where you're translating all different ways. Don't forget to go outward, inward, forward. You've got the transverse step, so that rotational pivot, and the dynamic calf stretch where you're slowly going back and forth. Emphasis on the slowly part initially to get that lengthening. All right, my friends, if you know somebody that has plantar fasciitis, feel free to share it with them. If you have plantar fasciitis, let me know how these things work out for you. If you need more advice, reach out to me and let me know. Have a great day.